So a complaint happens and you're a doctor, and this happens. This poor doctor is sitting there, thinks they're being investigated in one place, suddenly you've got the GMC, maybe there's a criminal court, the media get hold of it. Doctors simply are not equipped to deal with that kind of thing. And not surprisingly, this has been called death by 1,000 arrows. Actually doesn't matter what the outcome is, it's the process that kills you. I entirely accept throughout this talk that the patient is on the other side of this, but I'm looking at it, if you forgive me, just from the point of view of the medics just at the moment. And the whole complaints process, I would argue, is a problem because they have multiple jeopardy, which you don't get in criminal courts, massive prolonged timescales. Often you're not judged by your peers. The process is often incompetent. People who are running complaints committees don't know the process, don't know what they're doing. And even the GMC admits that doctors are guilty and proved innocent, actually, from one of their internal reports. This is entirely contrary to natural justice. So we tried to just get a little bit of a handle on this so-called no-blame culture, and we did this study back in 2015. We asked about 90-odd thousand members of the BMA to complete a survey based on validated questionnaires looking at mental health. 8,000 completed the survey. If you're going through a GMC referral, 15% were having thoughts of committing suicide. 22% moderate to severe anxiety. How on earth can we have a process that makes doctors feel that way, or anybody else for that matter? Formal complaint, written complaint to a trust, approaching 10% of doctors are having suicidal thoughts, 16% moderate to severe depression, and 13% anxiety. So these processes are making doctors ill, and they're carrying on working most of the time. And hardly surprisingly, the data shows that if you've had one complaint, you're more likely to get another one. You're angry, irritable, your relationship's falling apart, you may or may not have alcohol or drug abuse, and you're depressed. Don Berwick, of course, said this: fear is toxic to patient safety and we should abandon blame. Well, look at these data on what the response is to complaints. It is toxic, and blame is a huge part of it. But the question I would ask again is, what makes doctors who start off with good intentions stop caring? Well, I've shown you one reason. If you go through a complaints process, trust me, it's going to change how your outlook is. But I would argue the reason is probably burnout a lot of the time. Burnout has actually been defined by the WHO as a disease, and it's conceptualized chronic workplace stress, and it's got 3 dimensions. Emotional exhaustion you will perhaps be able to relate to. But it's important because it's usually related to people doing stuff they don't actually think is much use. Why am I'm wasting my time? Reduced personal accomplishment, not valuing what you do, having low self-esteem. But the most important is depersonalization, being negative, callous, cynical behaviors, poor interaction with colleagues and patients, unprofessional comments, inability to express empathy and grief. Sound familiar? So we tried to have a look at the scale of the problem. What's the position in obstetrics and gynecology in the UK? Because we're a high acuity specialty. And as we've seen, we do have problems sometimes. We basically wanted to know how much prevalence there was, what the prevalence was of burnout in the UK. We wanted to see if this was associated with something that harmed patients, and we looked at defensive medical practice and also obvious things, whether how old you are, your gender, ethnicity, and so on, impacted on whether you burnt out or not. We approached 5,600 gynecologists, trainees, consultants, and SAS doctors. And we looked at defensive practice using a questionnaire we developed previously with our work on complaints, looking at avoidance, which means you don't operate on complicated patients, you avoid doing difficult procedures or you abandon them, and hedging, which is over-prescribing, over-referral, and so on. Both are either damaging to patients or very expensive to the health service, or both. So the response rate, actually pretty good. 53% of consultants and 57% of trainees responded. So for this type of work, that's a good response rate. So we think this is pretty representative. And we found that 31% of consultants in O&G meet the criteria for being burnt out. 30% of SAS doctors, 43% of trainees already are burnt out in obstetrics and gynecology, which is, I think, pretty shocking. 16% of consultants are practicing medicine defensively, and already 11% of trainees are doing the same thing. And you can see avoidance. 1 in 10 consultants were avoiding procedures because they're either stressed or worried about complaints. Well-being and burnout, well, you're 4 times more likely to report depression, almost 3 to 4 times more likely to report anxiety. Same with anger, irritability, 6 times more likely to be having suicidal thoughts. It's a disaster for healthcare. And these people are trying to go to work and look after people and interrelate normally with their colleagues. And when you actually look at this, it's hardly surprising that you get the sort of situations that arise which we hear about in the newspapers. And yet, frankly, we're doing not enough or hardly anything in reality to deal with this, frankly. So what does it mean? Is there any significance? Well, I'll just quickly say what I think. Jeremy Hunt stood in the King's Fund in 2012, talking about another mid-staffs problem. He talked about coldness, resentment, indifference, contempt, normalisation of cruelty, legitimising, being callous, becoming mundane. What does that remind you of? I think these people are burnt out. I think that's why these things happen.